Okay, stop scrolling. Thyroid storm? It is one of the most tested emergencies on the NCLEX. I'm going to break down exactly what you need to know to pass this thing.
You really need to pay close attention here because just one tiny mistake on this topic can make you fail the whole question. So let's get right into it, starting with the absolute basics.
All right, first up, what even is it? Hyperthyroidism is just way too much thyroid hormone floating around. This basically cranks your entire body into a hypermetabolic state.
The best way to think about it, it's like your body's engine is just stuck in overdrive. I mean, everything is running way too fast and way too hot.
So what does this engine in overdrive actually look like in your patient? Well, the first classic sign you're going to see is heat intolerance. They feel like a furnace, constantly hot, sweaty, even when everyone else is cold.
In their heart, it's racing. You're going to see tachycardia. We're talking over 100 beats per minute. And they'll tell you they're having palpitations, like their heart is just pounding right out of their chest.
Okay, and here is the classic sign that just screams hyperthyroidism on an exam. They are losing weight, but they have a huge appetite. Their metabolism is just torching calories so fast that they can't eat enough to keep up.
So what do? The most crucial thing for your nursing care is safety. Your #1 priority is monitoring their cardiac status. That means you need a calm, quiet environment. We got to minimize stimulation to protect that overworked heart.
Okay, you need to lock this one in. This right here is an absolute NCLEX gold rule. You have got to report a temperature increase of even 1 single degree Fahrenheit immediately. Don't wait. This is your biggest warning sign that a thyroid storm is coming.
All right, let's talk meds. You've got two main groups here. First, beta blockers, like propranolol. These are just for symptoms, right? They slow the heart rate, help with the anxiety. Then you've got the antithyroids, like methimazole or PTU. These are the ones that actually stop the hormone from being made. They fix the root of the problem.
Now, let's talk about the complication that can actually kill your patient. Thyroid storm. This is a massive, life-threatening surge of thyroid hormones just flooding the bloodstream.
You're going to recognize it by 3 main things: a super high fever, extreme tachycardia, and a change in mental status. We're talking delirium or major confusion. So to manage that crazy high fever, the only correct answer on the NCLEX is acetaminophen. This is a huge safety point. You cannot miss this.
And listen, you never give aspirin. Seriously, it's totally contraindicated. Why? Because it actually increases the free thyroxine levels, which makes the storm even worse. This is a classic NCLEX trap they love to use.
Okay, let's switch gears. Post-thyroidectomy care. What's your first and most important priority? Airway. Always. A bleed at the incision site can compress that trachea so fast. Just remember your ABCs. Airway is always, always first.
And because that airway risk is so high, you absolutely must have a trach kit and suction ready to go at the bedside. At all times. This is completely non-negotiable for patient safety.
Okay, what's your second post-op priority? It's calcium. The parathyroid glands can get damaged or even removed by accident during the surgery, and that can lead to some serious hypocalcemia.
So, you need to listen really closely for this. If your patient reports any tingling around their mouth or in their fingertips, that is an emergency. That's your earliest warning sign of hypocalcemia, and you have to act fast before it turns into seizures and tetany. All right, you ready? Time for a rapid NCLEX check. First up, what are the classic lab findings you'd see in Graves' disease? You're going to see a low TSH and high T3 and T4. Basically, the pituitary is screaming, "Stop," but the thyroid just isn't listening.
Okay, next question. What is the very first sign of hypocalcemia after a thyroidectomy?
Tingling, right? Remember, that tingling around the mouth is that first critical sign. And for the last one, what is the correct medication to treat a fever during a thyroid storm? Acetaminophen, and never, ever aspirin.
You totally got this. Make sure you save this explainer and watch it again the morning of your exam. Go ahead and comment thyroid below for a practice question, and definitely follow me so you don't miss the next one of these high-yield reviews.